Hello and welcome, Dr. Gutierrez. Nice to see you. How's your day?
Fine. Just got up.
Yeah, okay.
Yeah, everything is going good.
All right. Good to hear that. I'm just going to pause a few minutes, or at least one more minute, to make sure everyone is joining us. These webinars have been huge success for us and for our patients. As I always, when I'm in Tijuana, I ask patients, how do they know me or the company? A lot of them are attendees for our webinar. So we've been doing consistently every month at least one webinar for our main informational webinar for weight loss surgery in Mexico. And we've been doing some other ones like revisional surgery we did. That was a really good success. We're going to probably do another one soon. But that's pretty much, we're still open to do actual seminars in Seattle, Atlanta, Utah, Texas, Dallas. So you guys can send us requests and make sure we have enough people and we will go. Canada, the same thing. Calgary, Edmonton, even Vancouver. Love Vancouver. So we go. Okay, so we got to get started here. Again, thank you for attending our monthly webinar for weight loss surgery in Mexico. I am just going to go over the raffle we offer with almost every webinar, which is you get, if your name comes out, you get a $2,000 off of the surgery package. Our surgery packages right now is the most affordable in anywhere, actually, because if you add up all the benefits that we offer in our package, there is no other company can touch this, especially with our new hospital. Hospital Azar that we opened. This is the state-of-the-art, brand new, beautiful luxury, everything, the best standards, the equipment, everything is the top of the line. So you get to go to a brand new hospital with the top surgeons like Dr. Gutierrez. He's actually our chief surgeon. We have a pleasure to have him today with us. But just going over the rules for raffle. If you guys don't have a health questionnaire already submitted to our system, please go ahead and do that. MexicoBariatricCenter.com. Find the health questionnaire link. Select Dr. Gutierrez, Alejandro Gutierrez, and watch the webinar to the end. That's all you have to do. And I would release the Zoom poll at one time. Make sure you do that. That's another requirement. But beside that, you just have to watch the webinar to the end and make sure you do the Zoom poll. And we continue. So again, my name is Ron Ellie. I'm the founder and director of Mexico Bariatric Center. I started medical tourism industry back in 2007, and I started the brand Mexico Bariatric Center, for short MBC, in 2012. Since then, we have been working with top surgeons like Dr. Gutierrez. And now we have our own hospital. We have performed over 25,000 successful surgeries. And here's the thing, since we put up these numbers, and these are not just claiming numbers, these are actual patients. And everybody else in the industry trying to match these numbers, and they are claiming, oh, we've done 15 or 5 or 10. And it's interesting because we know it's not true. But anyway, that's another story we'll go over later. We try to cover as much of the main questions or frequently asked questions that you guys have during the presentation. And if we don't, you can have a chance to ask us at the end when we open for Q&A. Pretty much topics that we want to cover today is obesity, its risks, its comorbidities, what is we call the side effects or side issues of being overweight and obese. We're going to talk about the ways to lose extra pounds. Weight loss surgery is the most effective at this time, dominant solution for prominent solution for obesity, morbidly obese. And we talk about how it works, why is it so effective, and we will compare it to other solutions. And we will talk about MBC, Mexico Bariatric Center, why you should choose us. We'll talk about our new hospital and the packages that we offer. We talk about the support programs we have, the way we work, the inner work of MBC. And Dr. Gutierrez takes over from there, talking about all the procedures we offer. We have one of the most complete spectrum or array of bariatric options, like laparoscopic, endoscopic, soon robotics, and he would definitely touch over the revisional procedures. We talk about some of the financing options that you may want to look into if you can afford it. And then we would open, I would release the Zoom poll at one time, and we would do the Q&A session. We try to cover as many questions asked. Sometimes we get hundreds of these questions, and we don't want to take more of your time. Maybe we want to limit to this to 1.5 hours or maybe 1 hour, 45 minutes. So if you can't get to it, the time doesn't allow, please do not hesitate to circle back and ask us. You can call our office. You have every patient is assigned a patient coordinator, dedicated patient coordinator, and that patient coordinator is always available for you to ask questions or anything you need. At the end, we do the raffle for $2,000 off of surgery packages. We all know what obesity, overweight is, and the reason, of course, is very simple. We don't have a very active life. We all sit at a desk or, get in our car, very convenient to just not walk or do any physical activity throughout the day. Of course, the high calorie foods that we have access to, the fast foods, ultra processed foods, sugary drinks, our body is not use or has no defense mechanism against all these factors that we are exposed to. In the medical arena, basically, they categorize people based on their height and weight, and they give them a formula which is called body mass index, BMI. Body mass index is just a formula that you insert your height and weight and it gives you a number. For the, people who are under 25, they consider normal. Over 25 to 30, they're like starting to become in the overweight zone. And after that, it's called obese. After 30, morbidly obese, super morbidly obese, super morbidly obese. And this goes on and on and on. So one thing about the criteria in our center for getting this procedure is pretty much at 30. And I'm so sorry if you hear this noise in the background because they're cleaning the parking lot. But so yeah, so we can go down to maybe 28, depends on your situation. Some of our endoscopic procedures, you can qualify with the lower BMI, like gastric balloon or ESG. Dr. Gutierrez will touch on those. And another thing is we don't have any upper limit. We are pretty much the Mexican version of 600-pound life. We do BMIs of 100. We've done 112, and we don't have any limitations on what we can handle in our center. Remember, when we talk about BMI, to put it into perspective, we're talking about patients who are 5, 6, 700 pounds. So that's the limit that we can handle in our center. Again, increased nutrient content of food, lack of physical activity, comfort eating, stress, that's huge. You know, we go home, we're stressed, we're tired. What do? We just grab food and eat it. Late at night is how I do it. I'm sure a lot of you guys have the same problems. Inadequate sleep, that's huge too. And then we are used to have large meals. I mean, that's a huge problem. We're just used to them. Buying stuff from Costco, right? They just go in there and load up. And so here's the fact that was for a long time was overlooked. It's like when you gain weight, or when we gain weight, not only are fat cells or adipose tissues increase in numbers and increase in size, their chemical structure of those adipose tissues or fat cells is also altered, and that's why is causing all these other problems we have, right? We're not responding to insulin, so we have to inject insulin. We don't respond to leptin, which means we don't ever feel like we're full. We don't respond to therapies. We don't respond to vaccinations. Even our muscles are becoming insensitive to protein and exercise, so they don't respond to amino acids. That's why when we gain weight, even the protein we take and exercise we do is not going to help our muscles. It's like it when we get older, right? That's what happens when we get older. So all these problems are major risk factors. 40% of Americans, I believe 30% of Canadians or adults are suffering from obesity. And obesity basically is affecting so many areas.
Breathe in and the diaphragm contracts and the lungs expand to take in oxygen. But if you're obese, fat in the abdomen can push on the diaphragm, limiting how much air you take in.
So that's a really good simulation of showing what happens, at least in our lungs. Other effects: heart disease, kidney disease, diabetes type 2, which is very common, cardiovascular disease, lung disease, cancer, certain kind of cancers, our joints, everything is affected in our body, right? And then another thing that put this obesity into perspective was COVID, right? During COVID, we learned, hey, we need to live a healthy life, because if we don't, these fat cells are a reservoir for coronavirus to attach themselves to. The more of the fat cells you have, the more chance of catching it, the more chance of ending in the hospital, the more chance of ending in ICU, and the more chance of death. So basically, we are shortening our life by not living healthy. So now we go over a cure for obesity, right? Diet, of course, we all have to eat healthy. That's a great idea. Exercise, yes. We gotta live active, lifestyle change. But when we have the extra pounds and diet and exercise alone is not going to help, or at least not for a big portion of population. And we'll see that in a minute. So diet and exercise is great, but it's not a proven long-term solution for obesity alone. Now we talk about magic pills, okay? Injections that right now it came with Ozempic type of medications, drugs. That is great, but again, is not a proven long-term solution because you have to keep taking it. And we will go over that. What are the side effects? So at this point, still bariatric surgeries are the only proven, quick, safe, and long-term solution for obesity problem. This is our body reaction to diet and exercise. So we have to overcome metabolism, increase hunger, and decrease satiety when we go on diet. So the difference between the diet and exercise and bariatric surgery comes with this magic word, which we call it metabolic reset. Basically, bariatric surgery resets our metabolic thermostat or set point, or however you want to say. Our brain is interacting with our hormones at a certain level based on what weight we are. Let's say if I weigh 250 pounds, like this guy in the red in my screen, my body is used to that weight because they're operating around that weight, because my brain and my hormones are interacting around that set point. Let's say I go on extreme diet and I do boot camp type of exercise. And I manage to lose 75 pounds. That's huge, okay? And I become 175. If you see from the previous slide I had, my hunger goes up, my metabolism goes down because my body is trying to push me back to the 250 that it's used to. The longer I am at 250 pounds, the harder it is to get back down to 175 because the body is like, hey, I want to go back to 250 because that's what I'm used to. When you do bariatric surgery, however, the minute you wake up because of hormonal changes, also the restriction in your food intake also, but the hormonal changes, and we see how many hormones are involved in after bariatric surgery that gets reset. My hunger goes down and my metabolism goes up. That's why I lose weight fast and I'm not going to be hungry the same as before. So that's the difference. Now, Ozempic is great. And what they're doing in the Ozempic type of medications, they're trying to simulate what the hormones are involved in bariatric surgery changes. Look at the right side of my screen. These are the known hormonal changes after procedures, that bariatric metabolic procedures. Look at that. We're talking about metabolic reset. That's what is coming. The only hormones that Ozempic and Mounjaro is offering is GLP-1 and GIP that I made it bold in my list. Look, ghrelin, CCK, PYY, amylin, all these other leptin. These are all the hormonal changes that they're trying to simulate by synthetic hormones. Remember, GLP-1 is a synthetic hormone in Ozempic. So they're trying to simulate that. Now, even the hormonal change, what happens to the restriction? When you say you get gastric sleeve, not only all these hormones are changing, you get restriction, you get a physical restriction. That means your food intake goes down. So that's the difference. That's why there is no comparison between Ozempic type of medication and bariatric surgery. It's great, but it's not the same. And you are playing with all the side effects. When you do the surgery, all these hormonal changes are happening naturally. But when you inject something in your body that you have to keep injecting over time, it has all the side effects. It can create cancer. It can create irreversible vision loss. It can damage your kidney, your gallbladder, and so many other factors. We're not saying it's not good, but it comes with its side effects. It's expensive. You have to keep taking it. So if you put this into perspective, you see that the diet and exercise is great, but it's only working for a very small portion of population. And then it comes to Ozempic type of medication, which they call semaglutide injections or tablets now, which is Ozempic, Wegovy, Mounjaro. Those are, again, works, but very small portion of people. And then it comes endoscopic procedures, which is like a gastric balloon, endosleeve, ESG. Those are, again, is great, but it's not working for a big portion of population. And then bariatric surgery, as you see, is the most definitive answer to obesity. And Dr. Gutierrez is going to go over it. Now you say, hey, this is a great tool. This is a life-changing tool, but how do I get it? Okay, your insurance is the first place you go because it's because of the instrumentation, the material is used in the surgery itself, and the fact that you need to stay in the hospital. In US, they're trying to do this like an outpatient, but it doesn't work like that. You really need to stay in the hospital under observation. You know how it is in US, they're trying to do everything outpatient because it's so much cheaper when you do the surgery and you let the patient go down to their house than keeping them in the hospital. You have to have a certain certification for that, certain requirements for that. It takes nurses shift at night, doctors shift at night. So that's why they're trying to do it outpatient, but that's not the way to go. So insurance doesn't cover. The out-of-pocket expenses is over, at the least, depends on where you are, is $15,000 or more. Yes, in Canada, you can get it for free, but then you have to wait a long time. You need to change your life. The sooner, the better. This is a life-changing experience. There it comes medical tourism. Where do you go? Mexico has set itself apart as a leader in weight loss surgery. And Mexico Bariatric Surgery Center is the #1 medical tourism for bariatrics in Mexico. And CDC requirements or recommendations is to go with a company like NBC. We arrange your pickup, your movement when you're in Tijuana. We've been around for a long time. You can see our reviews. You see our surgeons. So all this comes down to NBC, and we will see why NBC. Like I mentioned, we started NBC in 2012, And we are a US corporation in California. Our main office is Sacramento. That's where I am. Dr. Gutierrez is in our Hospital Azar in Tijuana. We're reaching out to you from 2 of our main hubs. And since inception, our goal has been providing top quality procedures at an affordable prices. Again, 12 years MBC has been in existence, 25,000. These are not, I'm just not throwing numbers to you guys. And this is not just a marketing number to show like how I see surgeons that have maybe done 1,000, 2,000, and they claim they've done 10, 15, 20. They're just throwing these numbers. These are not throwing numbers. We have top 5 surgeons in Mexico working for us exclusively. And our reviews, we didn't buy our reviews. Our video of our patients, you can go online and see their testimonials, the quality, and these are bulleted points of why MBC. One thing I recommend, you guys don't do price shopping. That is the worst thing you can do for your well-being, because you may end up with an inexperienced company, with an inexperienced surgeon that are compromising your safety. I always compare the surgeon's experience with a pilot. You don't want to put your life in hands of a pilot with few hours of flight time. You always want that experienced pilot to take you, because it's your life. You're risking your life by giving your life to some inexperienced surgeon. Yes, they're desperate. They don't work in quality centers, medical hospitals. They compromise in quality. We know, because I've been traveling in Mexico all over the place. We know what it's like. So they offer these cheap prices. They're actually not doing a favor to anybody. And they go on Google or Instagram, they put these attractive packages, but there's nothing behind it. The surgeon is, who knows who the surgeon is? Even the companies who offer experienced surgeons, they're not the one doing the surgery. They get some, that's just a face. Dr. Gutierrez is the one doing your surgery, every surgery. He's one of the most well-known surgeons in the world, but he's still working himself. He doesn't allow some other surgeon to come do the surgery. That's a difference. So be careful. Don't price shop. On the Instagram, all these places, they can put these before after pictures. They can Photoshop it. You don't know what's their credentials. You don't know what's behind the website. That's another thing. It's like, I always say, when I show up in Tijuana, they see me say, oh, he's the owner. Yes, I am the owner. Here's the face. You see us. You feel us. We are real. We're not just some unknown name behind all these. You don't know if it's an investor trying to create a business for themselves. We are here to provide the best medical services with the best experience you can have. So I like to maybe also show this video of our new hospital here. That's a huge reason for us to come with us. Here we go.
16th of September, lying on it, hourly. It's not too late. Couple thousand days, it's just a little sweet sour.
So we finally opened our dream hospital, and this is a game changer in the whole industry. This facility is, like I said, is the state of the art. It has 3 floors of ORs, patient rooms, and fully equipped. Patients have a great view, pretty much 360 view of Tijuana. You're way high in the air watching all this when you're recovering. It's, again, this is a game changer that we managed to open. This was my dream for years, and we started this project in 2021, and we opened in September of this year. We managed to open September. This was is called Hospital Azar, and this was a tribute to my mother that just passed very shortly after we opened the hospital. And you have a great experience in this place. Our prices are, these are special prices. You may want to take advantage of these because at the beginning of the year, it will change. So for a limited time, you get the gastric seat packages for as low as $4,395. Honestly, this is how much you have to pay for a root canal, not a root canal, I'm sorry, for a dental implant in the US. I paid about almost $5,000 for my implant. So imagine you're getting all this for that. Surgeon's fee included, anesthesiologist's fee included, hotel nights, hospital nights, pre-op, post-op tests, the medications. As I mentioned, there is so much supply, medical supply is involved in every bariatric surgery. That's why it's so expensive. Nutritional support, private transportation, before after care, our surgeon liaison, you're going to see where that comes into picture. And we're offering a discounted medical tourism insurance that I encourage you guys to take advantage of. Our support is beyond, you know, the amount of support you get from our Facebook group is out of chart. You can always reach us after surgery, before surgery, call our administration, get your FMLA paperwork done. All that we do for you. The amount of education we're giving to these patients before and after. Our coordinators have live events. Our nutritional support has webinars. We do webinars. So it's amazing what you get from us. The layers of support that you get. This is just our past patients that are helping us day to day. Sarita, she's more doing the podcast with Rina. She's more on the Facebook. Dawn is amazing past patient. Kelly just, she's our past patient. She just went to our facility, to our new facility, and got plastic surgery. Jamie, Yvette is our great. I mean, these people have changed their lives as you saw like before. This is like, for example, this is Jamie before and after. These people have changed their lives, and now they're compassionate about coming to work for us to change other people's life. That's what they drive them. Their drive is every day to do for other people what they did for themselves. We call them affiliates. So this is the kind of support you get. Again, for people who joined us later, if you don't have a health questionnaire in our system, please go ahead and do that. Watch the webinar to the end, and we do a raffle for $2,000 off at the end of the webinar. I would release the Zoom pool at one point before that, and please make sure you do that too. Our exclusive network of top bariatric surgeons. You see Dr. Gutierrez, he's our chief surgeon later on, Dr. Montalvo, Rodriguez Lopez, Jacqueline Husuna, Jesus Ceja. These are 5 teams of independent surgical teams, independent. They have their own team of anesthesiologists, experts, instrumentation, nurses, aftercare. Some of these companies, you see, they put a bunch of surgeons' face. They're really one team. They just put a bunch of people together and they do the surgery. Our approval process. When you submit your health questionnaire, it goes through our surgeon liaison with our complex routines that we have developed over years. They get distributed based on your situation, your needs, your medical condition to the best surgeon that fits you. Our surgeon liaison also sitting in the middle of all this, checking every health questionnaire. So you get matched with the best surgeon for you. And the surgeon is going to review your health questionnaire to make sure you get the best procedure for you. And because of the wide spectrum of services we offer, we are not going to force you to get what we can only offer, which is in some centers is only low BMI gastric sleeve, maybe bypass. We don't have limitations on BMI for bypass or BMI in general. We don't force you to get what you know, or we don't trick you. Sometimes they sign you up for some procedures. When you go down there, you say, oh, you know what, this might not be good for you, so let's just go with sleeve. We see this often, right? But you really need to get what you really need, because this is something is changing your anatomy and is better be good for you long term so you don't suffer. We use Hyatt, and our pre-op diet is very simple, straightforward. Based on your BMI, you basically do anything from 2-day clear liquid to a few weeks of pre-op diet. As far as medications, we instruct you if you're taking certain medications on a regular basis, what to stop, what to start after surgery, post-op. If you're taking Ozempic type of medications, please stop 3 weeks before. And any blood thinner, NSAIDs at least 1 week before. Take any medication you're taking on a regular basis, or at least take the bottle with you and to Tijuana. And then again, whether you drive or fly, we want you to be there before 12 noon and leave after 2 p.m. On the day you arrive, we do all the tests. We give you broth, Jello ice chips. Of course, before and after surgery, and you get a good night rest, ready to have the surgery tomorrow. If you have companion, your companion stays with you the first night, but you would stay in the hotel while you go to the hospital. They do have visitations twice a day, 10 to 12 and 5 to 7 p.m. On the day of surgery, you show up and they prepare you, they get you the surgery, you stay in the hospital for endoscopic procedures 1 night, and for others, sleep 2 and bypass and DS 3. We don't cut corners. We do the post-op test. They do multiple leak tests. And amazing patient care. On the day that you're ready to go, they bring you across the border and you're ready to go home, whether you drive or fly. Make sure you have compression socks on. If you travel long distance, be active, get up and walk every hour. Make sure you don't sit around. Our post-op diet, again, pre-op diet is basically low carb, high protein diet. And after surgery, these are very important to comply with. You have 4 weeks to go from clear liquid and liquid to solid. As you see, this is, of course, these all be emailed to you. We have webinars we go over, no worries at all. One of the reasons you want to go with us is we manage day by day our surgeon's load. And like based on complexity, we don't let them do maybe 3, 4 surgeries per day. And if you look at our complication rates, is less than 1%. And those are very simple complications. It's not life-threatening complications. If you look at the literature, it's about 2.8 plus in US. So we're like 25% of the complications. So we have 75% less complication than US because of our expertise, our dedicated center hospital, because of our surgeons' experience. These are dedicated bariatric surgeons. Dr. Gutierrez, he's a chief surgeon. He's not only a surgeon certified, general surgeon certified, he's a board certified bariatric surgeon. Very small surgeons have this kind of credential. He's also belonging to US FACS. He's certified there. He's regular attendees of all these international and national congresses like IFSO. And he has done easily over 5,000-6,000 surgeries. Remember, some of this data is old because they keep doing surgery, so we have to update that. Sometimes we fail to update that. I am sure over 6,000 surgeries. He's still young. He is there for you every step of the way when you're down there. And now he's going to take over and talk about all the procedures we offer. Thank you so much, Dr. Gutierrez.
Thank you, Ron. Thank you very much to all of you for taking your time and being here with us. We're gonna go over to the procedures that we do. As we were saying, obesity is becoming a pandemic that kills more people worldwide. And since 1991 in the US, the National Institute of Health stated that bariatric surgery is the most effective and durable treatment for obesity. So since then, it has been no changes. Nowadays, we have more technology, we have medications, but still bariatric surgery is the best treatment for obesity and its complications. So to go a little bit of the procedures that we do, so mostly we cover all procedures that are certified, FDA approved, We are always guided by ASMBS and IFSO guidelines, and we'll continue studying, so we can cover all surgeries that we do. So we're gonna go to the most common surgeries. So we were talking a little bit about endoscopic and laparoscopic. So endoscopic is becoming popular, very good result. Obviously, it's for lower BMI range or for bigger obesity grade 3 or 4 that they have some cardiorespiratory problems that they cannot undergo a procedure, a surgery. So they can do this in like a first phase, or sometimes it helps. So we're gonna go to the first one. Okay, so we have the gastric sleeve. So this is the most common procedure all around the world, bariatric procedure. Since we just go to the stomach, we don't go to the intestine. It's you could say easily done, non-invasive, and with very good results. This at first it was a two-step surgery. They did a DS. So in the first step they just do the sleeve, and then they waited a couple of months to complete the surgery. So the patient returned and they said, I'm feeling good. I lost a lot of weight and I don't want to undergo the other procedure. So since 2000, it's been done all around the world and with very good results. What we do is that obviously we go to the stomach and we're gonna remove like 80% of your 80 to 85%, an approximate of your actual stomach. And the goals of this is obviously we're gonna leave a tiny portion, long portion that looks like a sleeve. So the first goal is that you're gonna get full very fast. And second of all, that part of the stomach that we take out produces a lot of hormones. We were talking a little bit about them. And most known one is ghrelin, which is produced mostly in the fundus of the stomach. So after taking this part of the stomach, your body is gonna produce much less ghrelin. So this is a hunger hormone that's called. Normally it's produced mostly when the stomach is empty. So this hormone travels through blood flow, goes into your brain and causes you that binge eating, those craving sensations. So after having this procedure, patients do not have those cravings or have much less hunger than before. So this is the goal. It's a quick procedure, like a 40-minute procedure. And patients right after they're walking 2-3 hours after surgery, we start taking eye ships since you wake up, and at 24 hours after you're taking liquids. Okay. We have the SILS. SILS is a gastric sleeve, but it's single incision. So this is mostly for aesthetic purposes. Obviously you have to have some criteria met. Lower BMI, your liver has to be shrunk enough so we can do the whole procedure through the belly button. So this is mostly aesthetic. On the inside is the same. We do the same procedure, but just through the belly button. So it's a nice aesthetic procedure. Okay, we have the ASG, the endoscopic gastric sleeve surgery. This is part of the endoscopic treatments that we were talking about. This is it's not a surgery. This is just an endoscopy that we do with sedation. Outpatient patient can go the same day. So what we do is that through the endoscope, we have a special port that we can do suturing. So on the inside, we do like a gastric plication. It's a gastric plication, and to make the stomach smaller on the inside, you're gonna have your complete stomach, but it makes it smaller, so it mimics the sleeve and causes ghrelin to lower and to lose weight as well. So obviously the percentage that you lose is less. The time, it's not as durable as a gastric sleeve, but it's a good option for patients that are lower under BMI. So okay, we have the gastric bypass surgery. Gastric bypass is very known, still considered a gold standard until recently. It's a debate nowadays. So what we do in this procedure is that we're gonna go 2 steps. The first one, we go to the stomach. We're gonna cut the proximal portion. We call it the gastric pouch. And then the second step, we go to the intestine. Since the beginning, we count an amount, average 6 to 8 feet, depending on different factors. And then what we do is that we cut the intestine down there, take the distal limb, bind it to that pouch, to the stomach, and the other limb we bind into the same intestine. So food is gonna reroute. So instead of going to the complete stomach, complete intestine, it's gonna reroute that portion, bypass, and food is gonna go to the last portion of the intestine. So food is not gonna be absorbed, calories are not gonna get absorbed, but the same with vitamins and minerals. So we have to take care on that, to take vitamins, minerals, protein. So a good, excellent to reduce weight, excellent in the metabolic effect. We were talking a little bit about the hormones. So this communication between our brain and our stomach shifts into a healthier you. So very good results. And one very important, this is considered an anti-reflux surgery. So with patients that have acid reflux and obesity, this is the best treatment that we know nowadays. Okay. So a common question that what's best for me, obviously, we were talking a little bit about you send your health questionnaire, and we accept patients. If you choose a sleeve or bypass, some other procedure, we accept. But having you here and we get we touch base on all your background, and at the end we can say this surgery is the best that fits better on you. So we can say surgery obviously is up to you. It's your body, it's your health, as we're looking for. So but we can guide you to the whole procedure on choosing the best procedure. So gastric sleeve against gastric bypass. Obviously gastric bypass, if you are on a lower BMI, we said gastric reflux, that's very important. If you have like a very bad acid reflux on a daily basis, you take medication, you have to be sleeping seated. So that gastric bypass is the best for you. If you, it could depend. Mostly if you have like diabetes that's not well controlled, blood pressure. So both of them work, but the bypass works better, most durable, and faster. So okay, change the other one. We have the mini gastric bypass. Mini gastric bypass is a type of gastric bypass with a little bit difference on the technique. It should be called one anastomosis gastric bypass, or AGB. It's called mini because instead of doing two anastomosis, it's just one to suturing to stapling. It's just one, so it's like 15 minutes less of surgery. So that's why it's called mini. But the term should be one anastomosis. What we do is that the same. We're gonna go to the stomach and we cut the proximal portion, the pouch, a little bit longer because of the technique. And second of all, we go to the intestine until like 6 to 8 feet. But the difference is we do not cut the intestine down there. We take the intestine and we bind it to that pouch. So in surgery, we call it an omega loop. So it has the advantage of instead of having two anastomosis, it's just one. So obviously a little bit less complication rate of a bleeding, of a leak. And the anastomosis that we have is the proximal one, which can be reachable by endoscopy. So we obviously, you said a mini gastric bypass, you're gonna lose less weight than the complete bypass or the Roux-en-Y. But we got amazed 10 years after they did, this is an international study, and we got amazed because patients, they lose the same amount of weight, or sometimes even a little bit faster on the mini gastric bypass. So we can tell that results are the same between those two. Okay, so the same, mostly you can say that both of them could be one, could be good for you, but still the same. If you have acid reflux, we stick to the Roux-en-Y. Other than that, the mini bypass or the bypass are excellent surgeries. We have other surgeries which is more invasive, but obviously with better results. The duodenal switch or the SADIs. In this type of procedures, what we do is that we go and do a gastric sleeve first, and then second step is going into the intestine, but we start counting it since the last portion at the end of the small intestine. So average, we count like 4 meters and approximate like 11 feet. And then on the duodenal switch, we cut the intestine, we take the distal limb, and we're gonna bite into the duodenum. That's why it's called the duodenal switch. Instead of doing to the stomach, it's on the duodenum. So this has the advantage of having that valve still working. And on the SADIs, it's kind of like a mini bypass. We go to the last portion, but we do not cut the intestine. We bind it into the duodenum. So very, very good surgeries. Obviously, you have to be for certain people that they need to lose weight, they have some problems. You lose more weight, but you have to be taking care more closely to vitamins, minerals. Patients, if they're not follow the diet, they can have some diarrhea now and then. So you have to do a post-op care and do a follow-up with your doctor. But excellent results in losing weight. Okay. So we talked the same, it's kind of like the Roux-en-Y bypass and the mini gastric bypass. Both of them are the same, but with the SADIs has one less cutting, one less anastomosis. So nowadays SADIs is becoming very popular, and with very good results. So nowadays worldwide, the doctors are shifting or doing more the SADIs, but the duodenal switch still has its indications. Results the same. What happens? Some common question is that if you have PCOS, obviously the bariatric surgery is gonna help you lose weight and feel and look better, but it could help you with a lot of related diseases with obesity, gastric, high blood pressure, diabetes, sleep apnea. PCOS is a one common. So PCOS, it's a hormone-related problem, and after losing weight, those hormones get better, shift into a better use. So patients with PCOS they struggle to get pregnant. So after having this bariatric surgery, the fertility rate increases. So we have a lot of former patients that after surgery they got pregnant 1-2 times. So it helps improve your fertility rate and get rid of PCOS as well. A common question: how fast can I return back to work? This is going to depend on the type of procedure that we do and the type of work that you do. So this is very important. Obviously, it depends on if you have a age, other diseases, but normally we recommend in general like 2 to 3 weeks. This is gonna depend if you do like a desk job that you're sitting, not lifting heavy things. So we recommend 2 weeks. Some patients are returning back to work at a week. So we recommend that it's gonna depend on how you feel, because you're gonna be doing a pre-op diet, you're gonna be fasting the surgery, and we're gonna continue on a special diet. It's a 4-step diet. First step, a week, is just liquids and clear liquids, and then we move on progressively. So obviously you get your body into a malnutrition, temporary malnutrition state, but still your energy levels could lower, and you can feel a little bit tired. So this is gonna depend on that. We have some lifting restrictions. We recommend not to lift more than 15 pounds the first 3 weeks, and not more than 30 the first 2 months. So it's gonna depend on the type of work that you do. What we want to avoid is doing like heavy abdominal strengthening, like lifting yourself up, lifting heavy things. So it's kind of like that. But we recommend to start slowly when you return to work. Okay. We got obviously all around the world, COVID caught us by surprise. So we developed some additional measures to take care of yourself and us, the personal, obviously. So normally we still wear masks. Nowadays, during the hospital, it's recommendable, and mostly traveling on airports that you get in touch with a lot of people. So we recommend that you wear your mask. Obviously, social distancing. During COVID, the COVID test was mandatory. Nowadays, we recommend you to have it, to do it, but it's not, it's optional as you want to, and as well as vaccination. We obviously recommend it, but it's up to you.
Okay, well, great. Thank you so much for explaining all the procedures we offer. So as far as financing, again, our packages are extremely affordable, but if you need financing, you can look into the bank. If you have good relationship with your bank or credit unions, those are good places to look for money, to borrow money. SoFi. We do have on our website links to Super Money, which is a combination of a lot of these SoFi and Lending Tree and all that. Also, e-financing. And for Canadians, there is a company called MediCard that handles Canadians. So those are places to look for money. Now, one thing you want to do is not to apply for so many at one time, because it would affect your credit score and it would be harder for you to get money. There were a couple of things that I was a slide that I skipped over. I'm probably going to go back to it. A lot of people ask, well, how much weight do I lose? You know, I said, okay, bariatric surgery is a prominent, definitive solution for obesity. But like, okay, how much do I lose? Well, I would say you can lose all your extra weight. Depends on your lifestyle change based on genetics, age, all that, right? Again, how you keep up your diet. Again, the first 2 years, like your honeymoon period, when you lose weight, no matter what. But again, you have to plan this so you will be sustainable and you will be a long term. Another thing we're going to see at the end is taking bariatric vitamins. These are the things you need to put in your planning to make sure you lose all the extra weight. We see our patients, whether they're 400 pounds, 360, they get to their ideal weight with sleeve bypass. So there is no limit. Well, there is one factor that you have to look at. What makes the successful surgery? One is your will, is your pre-op diet. Pre-op diet is when you start. Pre-op diet is very simple. The last 2 days of pre-op diet is clear liquid. But before that is basically high protein, low carb, low sugar diet. Very simple. Take protein drinks, take salad with fish and chicken. Very simple, but it shows your commitment to your long-term success. That's when you start. It's a tool that you acquire, and how you use that tool. It's not magic, you have to work with it, but you have the tool. Now, here's like a formula, right? Based on your frame size, based on your being a female or a male, based on your height, it shows what's your goal weight or ideal weight. Well, ideal weight is what ideal, but goal weight is like you may not want to be quite that much, you know, weigh that much. So, but again, is your current weight minus how much you lose. In the literature, they say, oh, well, with sleeve, you use 65% to 75% bypass. I don't know, they throw all these numbers, 75%, 25%. It also depends on the skill and experience of the surgeon. Not every surgeon do the sleeve the same way. That's why it comes into inexperienced versus experienced surgeon. Inexperienced surgeon doesn't know exactly how much to cut to give you exactly what the results you need. But experienced surgeon has seen 6,000 of these. So they know how much to cut, where to cut. So remember that. The surgeon is important. Your lifestyle changes, your diet is important. But you can lose all the extra weight you want with these procedures, whether it's a sleeve, whether it's bypass. Of course, you have to get the right procedure too, right? Like Dr. Gutierrez mentioned, if you have acid reflux, this and that, you need to get the right procedure or you'll be suffering. So that's pretty much the formula that I was going to show you. So let's go back down to continuation, which was financing. And again, this presentation is going to be published on YouTube. You can ask for the link on Monday or Tuesday. We will send it to you. Just remember that. We were talking about why MBC. One of the benefits is that we offer optional medical tourism insurance at a highly discounted. You can buy this for $179 from us. Well, again, we are not providing this insurance. Another company is, but they gave us deep discount and we're transferring that discount to you guys. So something that will cost you $300, $400, $500, we're offering at $179. It covers complications, travel delays because of complications, all that. The maximum of $25,000 benefits. Our nutritional program is unique. We actually came up with a new continuation of the pre-op post-op diet support, which we call a Nutrition Plus. You can subscribe to that. Again, for long-term success, you need to do all this. Have support for after surgery, before surgery. This is our Nutrition Support Plus. And the vitamins are huge. Emerge Vitamins is what we've been offering to our patients. It's our own company. It's called Emerge Bariatric Vitamins. And it comes in soft chew, chewable, drinkable capsules. Try different ones, see which one works for you. You go to imagebariatrics.com and you can order it. This would be expensive to be shipped to Canada and overseas places. Get something, if you're in Canada, find something you can take over there. It's very important. You want your healthy bones after 8 years, you want healthy nervous system after 8 years, so comply with these ASMB recommended vitamins. At this point, we're going to open up our Q&A session. At the same time, I'm going to release the Zoom poll, as I mentioned, as I promised. So 5 questions, simple question. Please go ahead and answer. I just launched it. They're asking, should I order the vitamins before the surgery? At this point, you have to order this online. It is not available in Mexico. Hopefully in the near future, we will make it so you can pick it up on the way and go back home. Please order it before surgery so it's ready when you come back. Maybe you want to start maybe 2 weeks after your procedure. Okay, we send you home with antibiotics, some It's called gel plus, right? That's the medication they take for, yeah.
Yeah, it's like Melix kind of.
Yeah, it's like a Maalox. And so you don't need to buy anything. Maybe you want to buy some antacid like omeprazole, just over the counter. See if you need it. So is it true I can stop the vitamins after 6 months after having a sleeve surgery? We recommend at least a year and a half to 2 years post-op taking vitamins for sleeve patients, and maybe 5 years for bypass, and for DS, duodenal switch patients, probably definitely take it forever. So the prices that we offer is basically cash prices. So if you bring a cashier's check, cash, whatever, these are the prices. If you were to pay with credit card, there is a 5% that will be increased of the prices I mentioned. Renee is asking, I may have missed it, but if you are on insulin with diabetes, what does your A1C need to be before surgery? That's a lot of people ask that, Dr. Gutierrez.
Okay, yeah. Well, obviously, if has to be the closest to a normal range, that's better. Sometimes because ACE1 levels you could tell how your blood sugar has been the past 3 months. So sometimes it's high because of patients that have uncontrolled diabetes. So it's mostly that we take care of your the day of the surgery, that your sugar levels are on a normal range, and it could be high. But obviously, if you can take your medication, lower it a little bit, that would be better. But mostly we take care of how your glucose level is at the day of the surgery, a day before the surgery.
I have had some issues with gallbladder stones. Would having the surgery help that, or would I need to get it removed?
Okay. A gallbladder that develops or creates gallstones one time, it's going to continue creating them the rest of your life. So if you have gallstones and it's creating problems, so the best treatment is to take the gallbladder out to do a cholecystectomy. A common question is that well, any condition that makes you lose weight fast, medications, a disease, bariatric surgery, has the possibility of developing gallstones. Back in the 90s, 80s, when you did a bariatric surgery, it was mandatory to take out the gallbladder out as well. Nowadays, we've seen that it's like 25% of patients that could need a cholecystectomy after bariatric surgery. So some patients, they want to do it at the same time. And what we recommend is that you do a follow-up later on. In your case, if you're having problems with it, so I think the treatment is going to be at the same time or after, but it's going to be taking your gallbladder out.
So they're asking if I were to bring a cashier's check, how would I go about that? So remember, so when you sign up, so this is the process, right? So you do the health questionnaire, we assign you to the right surgeon, the surgeon approves you, you get an email or text say, hey, you approved. You have a chance actually to book yourself online at that point. If not, you contact the coordinator that was assigned to you, and they would take the deposit, whatever, they sign you up, they send you the paperwork, you're on your way to go. As far as payment, the first deposit is, again, just to make sure you get on the calendar. But after that, you need to pay or at least be accounted for or how much you paying 15 days prior to surgery. So if you're taking a cashier's check, you take the image, copy of it, and send it to your coordinator 15 days prior to the surgery. And then we know, okay, that's your cashier's check. And then you take it with you. They collect it on the day you arrive. So Dr. Gutierrez, they're asking, what are the side effects of gastric sleeve? Is there a hair loss, etc.?
Okay, well, yeah, a little bit of a hair loss is expected, and this is mostly because, as I was saying before, you take your body into a malnutrition state. This is going to be a big change for your body, and at first you're going to be a little malnutrition because of the diet, but we expect a little bit of a hair loss between the 3rd and the 6th month after, but this is going to be temporal. If you take proper care of your diet, eat properly, take your vitamins, minerals, your protein, the hair is gonna grow back again. So that's gonna be it. Another, you have to learn to eat, I say the proper way back again. We're gonna start eating very slowly, chewing properly, separating liquids from solid, half an hour. So it's some changes that you're gonna feel at first. If you eat like too fast or take a big gulp, you have nausea or vomiting. So maybe this could be the side effects. And the other is we have to take care on vitamins and minerals. So you can have some problem because of lack of vitamins. It's very rare, but you still can have it.
Okay, thank you. Which one is that? Okay, so we did talk about pre-op, post-op. Yeah. Okay, so Lucy's asking after VSG, the staples, and I'm worried that food gets stuck. I also have a very low pain threshold, which makes me anxious about it.
Okay. Well, about the staples, we use staples that are used all around the world. These staples are made of titanium, a special metal used in medicine in the whole body, even on the brain, joints. When you do a gallbladder, they put appendix, all of that. So a very common question is that if the body dissolves the staples, body doesn't have anything to dissolve metal. So what happens is that the body overgrows all around the staples, and they get into the tissue. So it's safe. You're not gonna, you can do MRIs after, metal detectors won't have any problems, so you won't feel them and won't cause any problem. About the food getting stuck, I don't know if you mean about the staples. For the staples, not going to be a problem. And the other is if you do a proper gastric sleep, you won't have that. And obviously, eating, as I was saying, slowly, and because of that, you won't have any problem because of staples. And pain, we have all kinds of pain medications down here. So we have a lot of patients there because of they having back problems, joint problems, knees, and they're taking morphine type medication, a prednisone, kind of like that. So, and they need more dose of medication. So we have all kinds of medication, and obviously we're going to give you as much needed for you don't have to be keeping up with pain.
I have severe acid reflux. Will the mini bypass also work for me?
Okay, we have to see, well, acid reflux GERD, it's a multifactorial disease, so it's because of different factors. Obviously, if obesity or overweight, it's a major one because the pressure inside the abdominal cavity increases a lot. So losing weight is going to help with that. But if you have like on a daily basis acid reflux, you take 1, 2 medications, you still have it, you have to be sleeping seated, sometimes in the middle of the night you wake up, it's been causing another problem, throat problems, sinus problems, ear, lung problems. So in that case, the best thing will be to do a Roux-en-Y bypass.
If you are vegan, how do you get protein before and after surgery?
Well, this is gonna depend on if you eat, for example, like dairy, if you eat some grains, you can take it. We normally recommend for you to take your protein, like a shake protein. So you can do those and do your normal vegan diet. So you won't have any problem. Obviously, you will still need to take more care on that, but you can take your diet, proper diet, and add the protein that we use.
They're asking most US bariatric surgeons I have looked into recommend a pre-op diet of liquids only for 2 weeks. Why does MBC only recommend 2 days of clear liquid for pre-op?
Okay, well, this is the 2 days is when you are on a lower BMI. Normally, we recommend if your BMI is bigger, we recommend more time of pre-op diet. Pre-op diet is gonna work for you mostly to take your body to prepare it for surgery for this big change. And second of all, it's gonna help your body, for example, your liver to shrink a lot. So it helps you on the after surgery and helps the surgeon because if it has less complication when you have a small liver, and we can do it with less incisions and better. So yeah, we recommend 2 weeks. Obviously, even we have patients that don't do it properly, we can still do the surgery, but it's best for yourself to do it as much time needed. Okay, so yeah, we recommend the 2 weeks or even more if you have a certain type of problem.
When is it safe to eat spicy food or salsa?
Okay, this is gonna depend on the type of procedure. For the sleep, obviously, we recommend when you return to your normal diet, and obviously you start slowly because you can have some problems. With the bypass, we can have at first we can have the risk of a marginal ulcer. So we recommend a little bit more time. And the same with alcohol and smoking. So it's when you return to your normal diet, you can start slowly and see how do you feel. It could cause you a little bit more like gastritis or kind of like that. But you later on you're gonna be able to eat everything as you do, obviously in small amounts.
If I have no gallbladder, do I qualify for a mini bypass?
Yeah, of course, it doesn't make any change. The only thing when you have prior surgery and mostly if it's been open, we expect a little bit more scar tissue. So it's a little bit more time consuming because we have to dissect all those scar tissue. But yeah, the same, we can do the surgery. We've done a lot of patients that they previously have their gallbladder removed. So no problem.
Okay, that's a good one here. It says, when are the labs done before surgery? Is it done in Mexico or can I do it in US?
Okay, every time, well, before surgery, we do a pre-op evaluation, and that pre-op evaluation has a blood work. It has to, the more recently, the better. So we take that a day before the surgery to check your levels at that time of the surgery. Obviously, we recommend patients if they can do lab work before back home, it will be better because sometimes we can modify the therapy medication, or even sometimes you can head back to your primary care doctor or specialist to modify some things that we don't like. But yeah, you can have those back home, but here at the hospital, we're gonna do another one at the time of the surgery to so they can be more recently and checked at the time of surgery.
Yeah, especially with patients who are coming for revision. It's huge to at least check your hemoglobin levels and make sure when you come in and you don't, you know, you'll be ready to go. We don't want, we want smooth transition when you come. That's why we want the payment stuff be taken care of, because those are the things you don't want to worry about before surgery. You want to be at ease, peace, and just have good energy, positive energy. And because that helps a lot with recovery, you know. I mean, people sometimes say, oh, we're nervous. It's like, it's okay to be nervous, but not too nervous, because that's not going to help you. Again, when you get the surgery, please make sure you get up and walk as soon as you can. Yeah, you will feel dizzy, you know, but you can ask the nurses to help you get up. Even, you know, a little bit of walking, anything will help. In one of the floors, it has a great open space that you can go around and around and around. That's really huge. We made that space like that for everyone to be able to walk and get that air out and be active. Why would you not recommend the endo sleep also get rid of same hormones the sleep does?
Okay, yeah, we recommend endosleep. It's a very promising new therapy. Obviously, right now, actually, this couple of days, they did in Europe, all the doctors went there and decided if it was good or not good. It's good, and it's recommended for patients that are on the BMI and lower the BMIs. This is grade 1, grade 2 obesity. And for graded obesity, it's recommended in patients that are to have a surgery. It's a problem with their heart, their lungs cannot keep up with a surgery at that moment. So it has very promising results, but they're not the same as surgery. This is an endoscopy treatment. It's not a proper surgery. So it helps with ghrelin, but because since you have the complete stomach, it's not the same result as doing a gastric sleep. But it works and it helps. Obviously, if you had that tool, so it's gonna help if you follow up indications, even with ghrelin production.
So this question has been asked multiple times. So most of the rooms in Hospital Azar is single, so you have your private room. We also have few double rooms, like this. Jason is asking, can I stay with my wife? Yes. So we have those options too. If you come in with, I've seen that, you know, they come with their friend or their buddies, surgery buddies, they come and they want to stay in the same room. Sure, we can have that option. If you don't, when we give you your own private. This raffle is for the surgeries that Dr. Gutierrez offers. And let's say if you're getting gastric sleeve with another surgeon and you qualify for the surgeries that Dr. Gutierrez offers, we switch you and we honor the raft. Is it safe to have 8 months after surgery having a baby 8 months out?
Yeah, yes, it is. If everything's fine with your baby, everything, yeah, you can still have it. There was a time that I had a patient, they did it, she didn't say that she was lactating at the moment still. And after surgery, she was collecting the milk. So we went to her and why didn't tell us, but everything went well. Obviously, we stopped the lactation because of the medications, but yeah, you can do it, and it's gonna help.
So the only thing you need to do as a follow-up when you go back home, at least, you know, after the first 3 months, do a blood test, make sure your vitamin, everything is set. And then after that, you just do your regular checkups. So do I need to get a doctor approval from my primary doctor for this surgery? Yeah, go ahead.
Oh, I was gonna say that not really, but sometimes it will be better to have it with your PCP, with your primary care doctor, since he can do a follow-up later on and be close to you for after surgery. But no, we do not need an approval only in special cases that patients they have cardiac problems, kidney problems, respiratory problems. In those cases, yeah, we need a clearance before approving the surgery.
Well, I need to just inject something here. Most of the primary care physicians in US are supportive of patients coming to Mexico. You find once in a while, you know, here and there that they're not supportive or they don't think it's a good idea. But also we have primary care physicians that they actually send their patients to us. They recommend their patients to us. We have had primary care physicians that themselves came and had surgery with us. So it just ranges, you know. What does your blood pressure ideally have to be in order to get the procedure done?
Well, this is the normal blood pressure that's between 110 and 70 millimeters of mercury. Obviously, in surgery, you get anxious a little bit. Could be high. Some patients very high because of high blood pressure and it's not well treated. So in those cases, sometimes we need to use special medications and we can continue the surgery. Or some others we have to wait a little bit to do special medications to reduce that. So obviously, all signs have to be in the range, normal range, so we can do surgery.
So what can you do? What can we be done if you have a hernia in your belly button? If
Okay.
you want to get sleep, yeah.
Okay. Yeah. Well, abdominal wall hernias are not a problem. We can still do the surgery. Uh, it is recommended some if it's a small hernia not causing any problem or a very umbilical hernia, we can repair at the same time. If it's bigger than 2 inches, so in that case, the best thing to do will be to reduce weight first. So because abdominal wall can loosen a little bit, and then do an outpatient surgery. This is mostly because if we do it with enough pressure inside the abdominal cavity, the chances of reappearing increases to 1% to 20%, so an approximate. So yeah, we can do it at the same time. If it's small, if it's bigger, we recommend that you wait until you lose weight.
Yeah, I mean, you can fly safe back home. Again, if you have a long distance travel, like if you're going to the very east of Canada or anywhere else in the world, it's a good idea to stay maybe extra nights in a Tijuana site or San Diego site. You can use Hampton Inn. Mention you're a Mexico Bariatric Center patient. They will give you special rates. If you want to stay in the Tijuana side, of course, just tell your coordinator, because we do all the reservation for hotel, everything for you. Yes, it will be extra charge, but we would arrange for all that. So you don't have to worry. Our basically MBC is peace of mind. And that's what we offer. How often does patient have diabetes type 2 and hypertension that gets reversed after the procedure?
Okay, this depends, but normally we expect like 80% an approximate. Obviously you can tell with the gastric sleeve it's like 70%. With the gastric bypass, it's like 80% or a little bit more. But this is gonna depend on you taking care after of your diet, obviously doing exercise and diet. That's a cornerstone. But yeah, most of the patients, say like 80% of patients, a year after surgery, they stop taking their medications, stop putting insulin, and just with diet, their glucose levels is controlled.
How long is the BSG procedure?
The gastric sleeve takes around 40 minutes, 45 minutes. So it's a very, very quick one. All procedures were done. We start doing IV medications, IV anesthesia. So you feel relaxed at the moment. You feel sleepy. You go to sleep. While you're already asleep, we put a tube under your throat and we continue with gas anesthesia. Right before you wake up, we take that tube out. You have any problems, and it's for you. It's gonna be like you go to sleep, you wake up, and surgery's gonna be over. So it's BSG is very quick.
Okay, so how long of a flight back home is safe after surgery?
We have obviously, if it's long as we were talking about, it will be preferable to take some measures. For instance, staying a couple of nights here will be better. We recommend that you wear your stockings back on during the flight. We always recommend to be moving around, like you can tell the flight attendant that you had surgery and just walk back and forth the aisle like every hour. If you're waiting on the airport, do the same. And if it's like more than a 5-hour flight, and depending on your background, sometimes we recommend blood thinners to take home with you. We have sometimes patients from New Zealand. There's a 15-20 hour flight, and they can return back home safely.
I get sick and vomit after waking up from surgery. Do you have something for that to give me during the surgery?
For nausea, Yeah. Actually, pain and nausea are the two most common symptoms expected after surgery, and obviously with any type of anesthesia and the surgery, we expect a little bit of nausea. But we always do a pre-medication before we start surgery, pain and nausea medication, and right after that, you're gonna stay in the recovery room. We keep on you like an hour, and we're gonna give all medication needed. So those symptoms are expected at first, and as time goes by, that gets better.
We have over 60, well, about 50 more questions unanswered. Some of them are repeat. Like I said, you know, about how long recovery takes after surgery. Can I lift weight? All that. Again, listen to your body. No heavy lifting, 8 weeks at least. Just don't do any, you know, extensive exercise. Just walk, you know, do simple things. So, but we are also almost 1 hour, 45 minutes. So I would recommend that we stop here. Please go ahead and circle back with our office, with our coordinators to answer any questions you have. We'd be more than happy to answer you. So I'm going to do the raffle right now. Here's all the names that are eligible for raffle, and I'm going to pull one out randomly. There you go. Jessica Sumner. I hope I didn't say your name wrong. Let me see about letting you talk, Jennifer. Jessica, I'm sorry, Jessica. Jessica, let me see. Oh, you're right here. She actually has her hands raised her hand. Hi, Jessica.
Oh, hi. Yes. Oh my gosh. Hello. Oh,
Hi.
thank
Well,
you. I'm so excited.
congratulations.
Yes. Oh my gosh. Yes. Thank you so much.
So tell us
Yeah.
about yourself. Where do you live? Some of your, you know, challenges that you've had, and you're ready to go through
Yes.
this.
Okay. Yeah. I was born and raised in Washington State, and then I lived in Utah for 5 years. But now currently in Florida for the last 6 years. And I've had PCOS since my hormones kicked in at 16, but I got diagnosed at 21 with PCOS, and I actually didn't know about. So I'm 30. I'm almost 38 now, and I didn't know about weight loss surgery, kind of to help correct that. So went through IVF, and it wasn't successful. So we did an embryo adoption, and so we have a 3-year-old son now. But would love to give them siblings, but yeah. So I've just put weight on since 16 once my hormones hit. So it's I just keep gaining weight every year. So just trying to yeah go this route, and I'm super excited to give myself a second chance of being healthy. So yeah, for my family too.
Great. We appreciate you sharing all that information. Again, well, thank you everyone for taking time and spending time with us. And thank you so much, Dr. Gutierrez. I know you have surgeries to do. Thank you for taking time and be with us. Anybody else who has questions, please reach out. And we'll see you down there, Jessica. We will have the coordinator contact you, or you can contact your coordinator. Okay?
Okay, thank you. Appreciate both your time.
Thank you so much, everybody.
Right.
We'll see you
Yeah.
next time. Be safe.